Hello, everyone. This is Jill Rourke from the CDC. I lead the Adolescent Immunization Communications team for the CDC, and we are pleased to have you join us today for one of our many preteen vaccine webinars. This is the second in a series about AFIX. This one is about the importance of being AFIX, those of you who are a part of the AFIX program, and tools for successful AFIX visits. So I'm just going to go over a few webinar logistics really quickly. We have muted everybody's lines, so you don't even have to worry about muting yourself because we've muted you for you. And because of that, when we get to the Q&A session, what we're going to have you do is actually type your question into that chat panel, and I think you can see that some folks have already started doing that. So if you have a question during the webinar, at any point, you can go ahead and type your question then. You don't even have to wait. We'll watch those questions come in, and then at the end, we'll go ahead and take questions. All right, so to get started today, I think we're going to start with a little audience participation. So we're going to do some polling questions. All right, so my first question for everyone is, have you ever participated in an adolescent AFIX visit? And your four options for answers are, you have yes, participated in an adolescent AFIX visit in the last year. Yes, it was more than a year ago. No, you've only participated in childhood AFIX visits, or no, you've never participated in any AFIX visit at all. So this doesn't matter what side you're on of AFIX, if you're a clinician or if you're the person doing the visit. Either way, just if you'll respond, and I think you guys should be seeing some of these results coming in. I'm going to give you a couple more minutes. Got about 350 participants right now, and we've got about 250 responses. So let's see where we are here. All right, I'm going to move us to the results. Oh, wow, look at this. Okay, so we have a wide range. We have folks that have participated in an AFIX visit that was an adolescent visit in the last year, and then we have a large group of folks that have never participated in AFIX visit at all. So this is, I think, going to be helpful for us as we know exactly our audience here. So hopefully this will be really helpful to you. And again, as you have questions, make sure that you're typing those into the chat so that we can answer those questions. All right, let's go to the next polling question. All right, so for those of you that have done them before, what I want to know now is, are you planning to attend an adolescent AFIX visit in the next year? A year, more than a year from now? You're not planning to attend an adolescent one, but maybe a childhood visit, or you're not planning to attend an AFIX visit at all. I'll give you a moment for those results to start coming in. All right, so we've got the majority are planning to do it in the next year. That's very exciting. This is good to know. I'll give a couple more minutes, see if we can get a few more people here responding. All right. Well, thank you guys for that. So now it is my pleasure to introduce our speaker for the majority of the program today, and that is Hanan, who is our fabulous AFIX lead at CDC. And if you would like to have the slides from this, we actually, as you can see here, have a URL in the slides, and that is for reference. You can't click on it now, but if you would like to request the slides, we can send them out to you, and then you'll have all of these URLs. But you could also just Google CDC AFIX, and you could get to the site. So now I'm going to turn it over to Hanan.
Thank you, Jill, and you're more fabulous. Can you hear me okay?
I can hear you great. Sounds good.
All right. So again, my name is Hanan Awwad, and I'm the AFIX lead here at CDC. I work for the Program Operations Branch in NCIRD. Today, during my presentation, I'll provide an overview of AFIX, the available resources for AFIX, and how this program can help us improve the national challenge of low HPV coverage rates. So what is AFIX? AFIX is a quality improvement process. It is evidence-based, or in other words, supported by research. It's a process for improving immunization coverage rates, reducing missed opportunities to vaccinate, and improving immunization practices at provider offices. The AFIX process is composed of four components: assessment, feedback, incentives, and exchange. The assessment is a standardized method that is used for collecting and analyzing quantitative and qualitative data on providers, which includes their vaccination coverage, the services, knowledge, attitudes, behaviors, and vaccination record management. The feedback session of the AFIX process is an interaction. It's an opportunity to sit with the provider staff and discuss the assessment findings and observations, and including, of course, the coverage results at that provider office. And then the discussion, CDC highly recommends that the discussion be collaborative, and it should be around ways to improve the immunization delivery system. Now, incentives are offered to providers and staff, and they take on different shapes and formats and resources, and they're really decided by the AFIX program. We fund 61 immunization programs that receive funding to implement AFIX, and these programs develop and implement incentives that they think are most effective for their providers. And really the purpose of the incentive is to provide for the, to give the clinician and their staff the encouragement to improve vaccination coverage and services at the office. And then the exchange is a regular follow-up process, and it happens 3 to 6 months from the feedback session. And it's a process where the reviewers, and by reviewers, these are the AFIX staff that conduct the AFIX visits. The reviewers monitor and support progress made by the provider staff towards implementing quality improvement strategies. And those strategies are developed during the feedback session using a quality improvement action plan. So that's in brief what AFIX is. Next, we have a video. And this video I'm about to share with you is, hang on just one second, okay, here we go. All right, so this video I'm about to share with you was shared during the second National HPV Roundtable meeting. This took place in Atlanta, Georgia. It was last week on August 30th and 31st. You could tell that there's a lot of great work being carried out to understand HPV vaccination best practices, to be implemented in order to improve HPV coverage. However, it's also important that we always keep the big picture in mind, the reason why we are doing the work that we do, and what are we trying to prevent. I'm going to go ahead now and play this video for you.
Well, having cancer impacted every part of my life really significantly. Of course, I was young and in great health and never really had a problem, and all of a sudden I'm dealing with cancer. And so emotionally, that was an incredible blow to feel like I wasn't a young, healthy man anymore. Physically, it was incredibly profound. Lost weight, lost strength, lost focus, ability to do things. It was a real struggle.
Cervical cancer is not an easy cancer, and the treatments and the psychosocial impact of it are incredibly devastating to a woman and the people that love her. For me, my treatments were physically devastating while I was going through it. It was horrific on my body. It was horrific for my husband to watch. I did not want them to feel what I was feeling, and yet they're watching me go through it. They were as emotionally scarred as I was. I didn't even know how much I wanted a little Chrissy with curly hair until I was told it's not going to happen.
Many of the women that I take care of with cervical cancer are young women who have not even begun their families yet. And to hear as a young woman that you have cancer, and then to hear that the treatment will completely take away your ability to have babies, that's a double whammy.
On June 14th, 2001, at 7 o'clock in the morning at Johns Hopkins Hospital, I had everything that I thought that made me a woman removed. And it was devastating for me. It changed my life forever. I think when people really understand how common the human papillomavirus is, they're like, wow, you know?
It's not limited just to cervical cancer. It has a huge spectrum of diseases, everything from cervical cancer, anal cancer, and head and neck cancer. And it can affect both girls and boys.
You need to realize that this is a problem out there, and it's a problem that we can't be shy about or uncomfortable with. It's a problem that everybody and anybody can have, and the consequences are huge.
When I have a patient who dies of cervical cancer, or even when I see somebody suffering with the treatment effects of cervical cancer, and I know that this is something that could have been prevented if that patient had had either access to screening or to vaccination, it just makes me so sad and so angry that we have not done a better job of educating the public, the providers, the parents about how important this vaccine is.
The hope that we have a vaccine that can prevent HPV-related cancers, I can't even describe that feeling for you, because it means that no one will have to go through the things that those of us who have HPV-related cancers do. It means that we can win the war on cancer, starting with these types of cancers.
This vaccine is amazing, and parents have the opportunity to utilize this vaccine to help ensure that these cancers do not happen to their children. This is their opportunity to be a superhero.
So now, after we watched that video, I want to take us back to the presentation and to speaking a little bit about AFIX. Let's look at this following CDC statement together. Receiving a recommendation for vaccination from a clinician is the main reason parents choose to vaccinate their children. Avoid missed opportunities by strongly recommending the HPV vaccine to parents of 11 to 12-year-olds on the same day and in the same way that you recommend Tdap and meningococcal vaccines. And we've provided here the link to where you can find that statement. So let's look next at our AFIX real-time data. So what is the data in the AFIX online tool showing us? For those who don't know what the AFIX online tool is, it's a web-based application. It's used by AFIX programs to record their AFIX site visit information. In looking at the following bar graphs, we can see that the vaccines assessed, and we can see their corresponding coverage. The orange bar here is this awardee or this immunization program's coverage for the childhood vaccination, and then it shows it for childhood and adolescents, so that's the orange bar. The light blue bar is the national coverage. So this is an average of all the AFIX visits that are being conducted nationally, and we can see that percentage in the middle. And then the dark green bar is the Healthy People 2020 targets that are national targets for us to meet. So what we see here is that the immunization program, and we have not provided any names, but this immunization program, this glimpse of the data, shows us that this program is doing well with their vaccination coverage, with the exception of HPV. They have reached their Healthy People 2020 targets for polio, for MMR, for Hib, hepatitis B, varicella, and PCV. And they're very close to reaching their target for DTaP. However, for adolescents, they've met the target for Tdap. They're very close on their MCV. So where do we see the problem here in this graph? The HPV coverage for this awardee for all their conducted AFIX visits is 27.6%. And the national average for all AFIX visits conducted as of this reporting point in time is 31.6%, while we have a 2020 national target of 80%. So, you know, as the AFIX lead at CDC, I ask myself, and these are questions that you know, we just wonder all the time, what is not working here? Is the message not reaching parents? Are providers seeing this data? Is the message not reaching providers? Is the message being conveyed correctly and presented using data and other tools? Are we taking advantage of available trainings, communication materials, AFIX tools, other resources? There's a lot that's not happening, and really the data just speaks volumes. And I know this is a challenge and this is a frustration nationally by me and by all of you. You know, with the help of our IPE team here in POB, we hope to find some answers and some responses to these questions. So low HPV coverage is a public health challenge. It is not something that one person or one agency or one program can fix. It's a true opportunity for a productive national collaboration. Use your data to create change. When you're conducting AFIX visits, use the data. Provide the list of patients that need to be recalled, that need to be reminded. It is important to show that data to your provider. Use available tools and resources. Avoid duplicating efforts. Ask questions. Ask for what you need. Think outside the box and figure out what's not working and make a change to it. Let's move on now to the AFIX goals as we have them here at CDC. So our goal is to decrease morbidity and mortality caused by vaccine-preventable diseases. Improve immunization practices at the provider office. Decrease missed opportunities to vaccinate. Improve immunization stakeholders' knowledge, understanding, and accountability about vaccines and their importance. And you know, now that we know what AFIX is and we've seen some of the data, these goals can be implemented. Are there tools to help you implement and reach those goals? Yes, there are, and we will get to those a little bit later in this presentation. Additional goals for AFIX: increase and sustain high immunization rates for children and adolescents served by VFC-enrolled providers. We need to plan on reaching the Healthy People 2020's targets for vaccination coverage levels and plan on reaching the Healthy People 2020's targets for AFIX. And the target there is an annual assessment of 50% for public providers and 50% of private providers by the year 2020. And then as the AFIX programs on this call well know, we are working really hard to improve the efficiency of AFIX visits in terms of transitioning AFIX assessments to the IIS, enhancing the functionality of our AFIX online tool, and then also developing training resources and accountability measures. So if we really look at these goals, improving HPV coverage is embedded in all of these goals. Now, looking at more of our real-time AFIX coverage data. In the bar graph at the top, we're looking at a awardee level coverage comparison between the first and the second assessment. So for AFIX, we have an initial assessment, and then we have a follow-up assessment that happens 3 to 6 months later. So we can see here in this graph that the coverage for HPV went up by 9.4 percentage points, and that is a good change. In the lower bar chart, we see an awardee level coverage comparison between calendar years 2015 and calendar year 2016. In the chart, we see that the HPV vaccination coverage for calendar year 2015's follow-up assessment is 34.4%, and the HPV vaccination coverage for the calendar year 2016, and this is the follow-up assessment, as in this is the second assessment that happens after the feedback sessions. So for the follow-up assessment in calendar year 2016, the coverage we're looking at is 46.4%. So that's a large increase. It is 12% points. There's an increase in the HPV vaccination coverage for follow-up assessments conducted. Several factors, as we all know, may be contributing to this increase, including but not limited to new strategies implemented for AFIX, new communication strategies. There may be policy requirements. There may be training of AFIX staff that happened. Maybe there were some data quality measures taken into account. The question that we ask is AFIX contributing to improvement in coverage? Yes, we believe it is. A well-conducted AFIX visit with the correct decision makers in a practice should result in improved vaccination coverage rates and immunization practices. Does AFIX contribute to a large increase in the percentage point for coverage? This really varies. It varies from one awardee to the other. It varies from one practice to another, from one reviewer or an AFIX staff member to another. Once the immunization program evaluation is completed, we hope to share what was defined as promising practices for improving HPV coverage and make sure that immunization programs have that information for their consideration and their action. In the next slide here, so this is the real-time AFIX quality improvement data. So on the main page of the AFIX online tool, each awardee or each immunization program, again there are 61 immunization programs that receive AFIX funding. Each awardee has a dashboard. What the dashboard displays is the top adolescent QI strategies answered no, and the top adolescent selected QI strategies for implementation. The percentage that we see is for awardees, and a national percentage is also provided here. I'm sorry, it could be a little bit clearer, but this is the best we could get it. As you can see on the left-hand side, the first strategy of do you inactivate patients in the IIS who are no longer seen by your practice? This was answered no for 33% of this awardee's visit, or a third of their conducted visits. We look at the quality improvement strategy number 2. So this is a quality improvement strategy that's second in percentages of answered no. This strategy is, do you routinely measure your clinic's adolescent immunization coverage levels and share the results with your staff? And the third strategy that's answered no the most frequently based on this data, do you have an immunization champion at this practice that focuses on QI measures, reducing barriers, and improving coverage levels? Now, in looking at the other side of this screen, the top adolescent selected QI strategies, it's showing us that the most selected strategy for this awardee, for this immunization program, is the strategy that is selected as no the most. This is data that we like to see. If a practice is not implementing certain quality improvement strategies, we want to see in the data that these strategies are being implemented by that provider office. And these QI strategies are strategies that are proven to be to improve immunization coverage levels, and hopefully with practices changing, immunization practices changing, the improved immunization coverage can be sustained for longer periods of time. So we can also see the second one is also selected at 32% of the visits, and then the third one is 17%. So the importance of the first one is if you inactivate the patients in the IIS who are no longer seen by your practice, that improves the quality of the data that is being run for assessment, right? You are making sure that the patients that are seen by a clinic are the correct list of patients that are owned by that provider, that the provider takes care of, so that when you're running assessments, your assessment data is accurate and your AFIX discussion is credible. Then do you routinely measure your clinic's adolescent immunization coverage levels? It's really important to encourage providers to assess their coverage through the IIS where that's available and feasible. And in assessing their coverage, they may select and choose to implement quality improvement measures within their clinic, which would be really good if providers can have that knowledge, can see this data, and can be proactive in improving the quality of services in an office. And then the third one, the immunization champion. It's really important to have an immunization champion in every provider office, someone that is really working hard with the rest of the staff in the clinic, including the provider and the decision makers, to improve the immunization practices and raise the immunization coverage rates for a practice. So this is, just to give you examples of the data that we collect as part of the AFIX visits. For this one, and I'll be very brief with this one, so for each provider that receives an AFIX visit, it's really all VFC enrolled providers. For each provider, we have an individual dashboard in the AFIX online tool. And for this provider dashboard, we're looking at real-time AFIX provider data. So here in this screen, we have the provider summary at the top, the provider's name and PIN and so on. And then the assessment date, this is the latest assessment they've had. So it was conducted on August 19th, 2016. Then the next section below that assessment date really takes you through where your AFIX visit stands, what's in progress, what's been completed, and what is remaining to be done. Now on the right side of the screen, we see the childhood coverage rates, because this assessment was childhood, and we can see what the provider's rates look like. That's the blue line bar on the left side. And then you can see in the middle what other providers in that jurisdiction, what their coverage looks like compared to this particular individual provider. And then again, we look at the Healthy People 2020 targets to see where this provider stands in relation to those Healthy People 2020 targets. So this is a good overview of what that provider, where they are in their coverage, and this is a report that can definitely be used as an incentive for providers because oftentimes if providers in a jurisdiction cannot, they're not aware of what their coverage is or what the coverage of other providers around them is. So if that can be explained and shown in a report such as this one, that could be a really good incentive during an AFIX visit. We're working for AFIX staff that are on the call. There's a question about the printing of those dashboards. We're looking, the dashboards are currently printable, but the AFIX, the informatics team here in ISD is working closely on developing more user-friendly and reports that have a better and more professional appearance, because we do think these reports could be really instrumental in getting the message across to providers. So just a quick peek at our data from 2014. We're still analyzing the data for 2015, and we will present that as soon as it's ready. But this is the data for calendar year 2014, and we have our standard site visit questionnaire for AFIX, which consists of 18 standard questions. And what we see here, and I'll explain a little bit more about the questionnaire once we get to the questionnaire slide, but what we see for this data for the calendar year, and this is for all the states and for all the AFIX visits that were conducted in calendar year 2014, we see that the top 5 most selected QI strategies for that year were: do you inactivate patients in the IIS who are no longer seen by your practice? Do you have a reminder recall process in place for pediatric and adolescent patients? Do you routinely measure your clinic's pediatric adolescent immunization coverage levels and share the results with your staff? do you contact patients and parents within 3 to 5 days of when a well child or immunization-only visit is a no-show and reschedule it for as soon as possible? And then the last one that was selected the most is, do you have an immunization champion at this practice that focuses on QI measures, reducing barriers, and improving coverage levels? So those were the most selected QI strategies. And this is, again, an example of what the AFIX staff in the field are working hard on. They are making a difference in not only focusing on the coverage rates, which are part of the AFIX process, but we're talking about quality improvement and what processes are feasible for providers to adopt to improve the quality of their immunization services. Moving on to the next one. All right, so as for AFIX resources, and some of you are very familiar with these resources, others may not be as much. We have our Policies and Procedures Guide. This guide includes CDC standards on what AFIX is and also what the different components of AFIX are, and pretty much the policies. What are the requirements, what are the recommendations in terms of policies, and also how to implement each of those processes. And we have a version 2 which we are planning on releasing later this year, but it should be available for use January 2017. And this guide will be available also on the public website for programs that are interested in AFIX that may not have access to SharePoint or other sites that are only available to immunization programs that are funded by CDC. We have, for example, the AFIX overview. It is a document that outlines what AFIX is. There's the AFIX site visit checklist, which is a checklist of, what do you need to know about the provider before you go to visit them and conduct feedback? What materials should you bring to the visit when you go to conduct the feedback session? And what materials do you need to leave behind after you complete your feedback session? And then we have the AFIX site visit questionnaire and answer guide, and I'll discuss that a little bit more in the next slide. We're working on a training manual for reviewers, and this will be released soon, where it's going through final reviews, so we're hopeful and optimistic. And it's a step-by-step guide on how to conduct each process of AFIX and also each component of AFIX, and also how to report these components. Then we have a QI action plan and a QI action steps. I'll go over those briefly in the next couple of slides. So here, just again, all the AFIX resources can be found on the AFIX website or in the AFIX online tool and in SharePoint under AFIX. If for colleagues on this call that they don't have access to SharePoint and you're interested in looking at any of those materials, please do not hesitate to contact me, and I'll make sure to send you any of these documents if you're interested in reviewing them. So this is the website for AFIX here, provided here, and the other website is for SharePoint, which is a portal site for immunization awardees. So it's really restricted for immunization programs that are funded by CDC. So just to show a few examples of the tools that we have for AFIX that are hopefully used and that can really help us in not only addressing the coverage rates, but also discussing the immunization practices and the education and the training and the understanding of vaccines, particularly HPV, as that is really a priority for all of us here at CDC and also nationally. The site visit questionnaire provides a list of questions that ask about whether or not a practice implements evidence-based strategies for improving immunization practices and ultimately immunization coverage. These are some examples of the questions available in the document, and the link where the document is available is provided here at the bottom. The site visit questionnaire was prepared by CDC in collaboration with the AFIX advisory group, and we were really careful about making sure that each of those strategies is evidence-based, or or another word for evidence-based is that it's supported by research. Research proves that these strategies, if implemented, can improve immunization coverage at provider practices. Another tool that, just to share with you, we have also an AFIX site visit answer guide. These are responses to each one of the questions in the site visit questionnaire. And here we have the question. This is a table where, the first column here is the question, then the provider's response. Then we give key points to use for reviewers or for whoever decides to implement AFIX and conduct a quality improvement visit. These are key points to discuss as part of your response. And then we provide reference materials on the right-hand side in this column for you to review and learn more about what each of those strategies mean and how they can be addressed. And then the last just kind of example of what we have in terms of AFIX resources is we developed, we ask those 18 questions to providers, and we collect in the online tool their responses, yes and no. And we also collect, as you've seen earlier in the slides, the quality improvement actions or the quality improvement steps that they select to implement. But we all were thinking, not just at CDC, but as an AFIX community with the AFIX programs and the field staff, we have those questions, but what sub-actions do we need to provide here at CDC so that we can take a practice from asking the question and getting the response of yes and no to actually suggesting and recommending strategies for them to implement in order to meet and reach this strategy. So here's an example of one that we have: developing a reminder recall process for your practice. So if a provider says, you know what, this sounds like a good idea, how can I go about and implement this as a QI action, a quality improvement strategy? So in this quality improvement action steps, we say designate an immunization champion to lead and coordinate the reminder recall efforts, develop reminder recall procedures for your office. It will include the frequency, methodology, age cohort, and responsible personnel. And then the third suggested step is utilize the IIS to run and send reminder recall notification to children and adolescents. And this, of course, is dependent on the IIS and the quality of the data in the IIS. So it's not, we don't require these action steps, they're just recommendations, and immunization programs are free to utilize these tools as they see fit and add any additional QI steps that they want to these templates. And we provide a definition here of the reminder recall. Who's the point person to check back with is the point person column. It's important to find a point person in the office when you're conducting an AFIX visit. You want that person who remembers your visit, and then when you check back with them 3 to 6 months later, you want to contact that particular person to say, what has happened since we left? Because we talked about implementing reminder recall in your practice, and now we talked about a time frame for the implementation, and because again, AFIX is a collaborative effort. You work with the provider staff. We're not there to tell them what to do. We are there to lead a quality improvement and informational session and really support them in developing sustainable and feasible improved immunization practices for these practices. So it's not compliance, it's quality improvement. So this is sort of quality improvement action steps for an action plan. We talked about 3 months for implementation. Then we have here that the initial follow-up date will be April 4th. And so on. So this is another resource that's available, and we're happy to share it with anyone who would like to see it. And then we have additional references and resources on the right-hand side so that staff, reviewers, AFIX staff conducting visits, even providers can read up about these resources. And I think with that, kind of looking at these tools can definitely help us go back to those goals we talked about and see how can these be used to improve the coverage, to improve immunization practices, to reach the Healthy People 2020. What is it we need? What is it that is available? Don't hesitate to reach out and ask for what you need. Ask for what you don't have information about. nobody knows everything about one particular subject, but we do know that there's someone that could help with anything that is needed and with any response that we are asked questions about. And I'm going to turn it back over to Jill to talk about the communication resources available from our communications team.
Thanks so much, Hanan. All right, everybody. So I'm going to talk about the communication resources that might be utilized during an AFIX visit. So I know that sometimes in the action steps, it might be something about training or education for folks working in the clinic. One of the things that comes up the most often is that clinicians feel like they don't have the right language to make an effective recommendation for HPV vaccine, and that they can't answer the questions that parents may have. So we have a tip sheet called the Addressing Parents' Top Questions About HPV Vaccine. This used to be called Tips and Time Savers. It's changed a little bit based on your feedback. And right at the very top of it, right underneath the headline, it actually gives a very succinct way for providers to make the HPV vaccine recommendation, and that is actually to bundle it with the other vaccine recommendations. So going back to that slide at the very beginning that talked about the importance of provider recommendation, it suggested that giving an HPV vaccine recommendation on the same day and in the same way as the Tdap and meningococcal conjugate vaccine recommendations is the best way to achieve higher coverage. And so we suggest that all clinicians start that vaccine discussion by saying that now that your child is 11 or 12 years old, they are now due to receive vaccines that will help protect them from meningitis, the cancers caused by HPV, and also provide a booster for whooping cough. And then it goes into very common questions that parents ask clinicians, and then some answers that you can use. And so we encourage you to share this with clinicians that might be struggling with their rates and struggling with their ability to communicate clearly about HPV vaccines. It also works as a great in-service tool for the rest of the staff as well. We always encourage that there be an HPV vaccine champion in the practice, and then that person conducts, short in-services with all of the staff in the office. Another way to do that is with the You Are the Key to HPV Cancer Prevention slide deck that we have available, and it's easily requested from us, and we update it regularly. So we actually just updated it with the new HPV cancer numbers. There's a lot of slides in here, and we encourage folks to use this in and out of their practices. And it can also be used by AFIX and VFC staff to give presentations to single or multiple practices at a time. If you have folks that are looking for continuing education, we actually have an entire page of continuing education on our HPV website. And one of the things that's on there is this one that we did at CDC. It is a basic You Are the Key presentation. Does go over a few of the communications resources as well, but really gives information about HPV infection, the cancers, as well as information on vaccine administration, scheduling, things like that. So that's a good way to get a credit of CME for clinicians who are looking for that. And it's available for not just physicians, but also nurses and health educators and pharmacists, as well as nurse practitioners and PAs. There's a whole lot. So there's an entire list there. Next, I'm going to show you a series of fact sheets that we have available. This, again, is something that can be offered to provider offices for them to use with parents or to give to parents before an appointment. We have a practice that regularly downloads these and prints them off just in black and white. These print really well in black and white, and they actually send them out to parents before their child comes in for the visit so that the questions are answered beforehand. So we have a very simple version, which if you get it from order it from us from the warehouse, it's English on one side and Spanish on the back. And this is really good for lower information seeking parents. So those parents that aren't saying that they're, looking up studies online and things like that. It's just sort of basic information about HPV vaccine. Here's our more in-depth fact sheet. It also has a story from an HPV cancer survivor. This is really good for your more higher information seeking parents. So those parents that are, using Google University to find information about HPV vaccine, this is good in-depth information for them. We have it in Spanish as well, as you can see. We also have some fact sheets that are written specifically around HPV vaccine safety. This is one that's about HPV vaccine safety and effectiveness So again, this would be, two different topics in one. So for your lower information-seeking parents, for those, this is another that's just about HPV vaccine safety that can be used for that same reason. And then we have one for higher information-seeking parents. Has an entire list, as you can see on the right, of various HPV vaccine safety studies. We do get parents who ask all the time, well, I want to be able to read some of those studies. Can you tell me where they are? And so this is if you are doing AFIX visits for a practice that has very high information-seeking parents, this would be a good resource to offer to the providers to say, here's something that you can give to those parents, or link to it online. They can put it on their own website. They can syndicate the content from CDC. All of these are available on our website at cdc.gov/HPV, or if you request the slides today, you can actually, once you have the actual slides, you can click on these links and it will take you to these fact sheets. All right, so that is what I have for today, and now I am going to turn it back over for questions. And I think we have a few questions here. Hanan, are you ready to answer some questions? I'm going to answer the first one, which is from is about the very first video that you showed. So yes, those videos were actually created by the HPV Vaccination Roundtable, which is being run by the American Cancer Society. They are available on YouTube, and we did put the short YouTube link up on that, and I can actually scroll back and show that to you real quick so you can see where it is. So you can see up at the top, we've got there the YouTube link so that you can see that. You can actually embed this on your health department's website. They are free and available, open to the public for anybody to use. So if you'd like to do that, you absolutely can. All right, I think the rest of the questions are going to be very AFIX focused. So Hanan, can you see those questions on the left, and would you like to answer some of them?
Yeah, where, Jill, should I start with, there's a, what is AFIX? We covered that. Let me see where. Okay, I'm scrolling down to find them.
Next to chat, you should see something that says questions. I think it has a 5 in it, and that'll be the
Oh, here we go.
Questions
Yes, I'm sorry. I was looking in chat.
No problem.
Okay. Here's so the first question, there's an anti-vaccine orthodox magazine titled PEACH that give reasons to oppose the HPV vaccine. Is there thought for a magazine pair in the future about the benefits of the HPV vaccine?
I can answer that if you would like me to.
Yeah, because I'm not aware of a magazine that AFIX will be generating.
Yeah. So we have a lot of communication materials. Not only are we creating things, but so is the American Cancer Society and a lot of our partners. And typically, we don't create things that are in direct opposition to something that somebody else puts out, but we do have a lot of really great materials. And, we encourage folks to link to those, whether it's linking to, some of our fact sheets, linking to some of our videos with survivors, like we showed earlier today, linking to the Someone You Love movie, which is a really powerful movie, or just, we've got very short 30-second PSAs about cancer survivors recommending HPV vaccines. So that's what we recommend for that.
Okay, so thanks, Jill. I'm moving to the next question. It's about most provider sites do not enter directly into, I'm thinking this is New York State's IIS, and to inactivate a patient, it requires duplication of data, their EMRs and their QI levels, and NYSI is a reporting system for the data, not necessarily the provider pair does. Okay, so for this question, does the IIS in New York State have the ability to inactivate patients linked to EMRs? This is a question that I don't have the response for here at CDC. This is something that the IIS manager at New York State should be able to easily answer. And if there's no response to the question, please email it to me and I can send it to our IIS branch here at CDC. And then the next question, Jill, can they see the questions? Should I read them out or just respond?
I would read it out just in case.
Okay, all right. The next question from Freddie Barber. We have several providers who exaggerate the amount of inactive clients to get them out of their cohort. Do you have any strategies to determine if this is happening or a strategy to prevent this? So we know this is a challenge that we've had with providers. Kind of before an AFIX visit, they will inactivate the patients with low coverage so that their coverage rates look higher for the purpose of the AFIX visit. Again, this is, you would need to have policies for your IIS that control when and how patients are inactivated by providers. I can definitely ask around, again, this is a question that we need to ask the IIS branch about if they have a list of strategies or measures, and also other AFIX coordinators can definitely answer that. So I will get with you, Freddie, after the call and provide additional resources. Does the next question, does the reviewer help the provider staff carry out the action steps, or do provider staff do that on their own? So the reviewer, when they are conducting the feedback session and they are discussing the results of the assessment, and they are presenting the site visit questionnaire, they go over each question in the questionnaire. They discuss that with the provider staff. And afterwards, together, they come up with a quality improvement action plan, which includes these action steps. Now, the implementation of this QI action plan, along with those steps, is the responsibility of the provider and their staff. And that's why it's important to find an immunization champion at that clinic so that this person can take on, the responsibility of making sure that these strategies are implemented. And we do recommend, once you let them know that there will be a follow-up process 3 to 6 months later, we need, the expectation is that they will have started the implementation of those QI action steps. You'll have a date on when they expect to complete it, even if it may be after the follow-up date. The follow-up date is a check-in with them to make sure that they don't need support or have additional questions. Sometimes they have staff turnover, so you might want to check in and just ask where they are with the status of implementing the QI action plan. That's the purpose of the follow-up. And then we continue to do follow-up with this clinic until you ensure that the QI action steps are 100% implemented. Because, again, to adopt these QI strategies and to partially implement them, we're not making any difference. They need to implement them and reach 100% on implementation so that we can start to see the results of those QI strategies adopted at the provider level.
Okay, I'm going to jump in real quick. We're going to answer some more questions, but before we do that, I want to quickly do our evaluation questions before we lose any more people on here. So if you could tell me, how helpful was the information presented during this webinar? Your options are very helpful, neutral or no opinion, and not helpful. And I'll give a minute or so for folks to be able to respond to that.
And Jill, are you able to take the next question? I think it's
yeah,
more for
I
you.
can absolutely. While folks are answering that, I'll go ahead and take the next question. So let's see. Succinct resources for providers who read the Medscape article on chronic conditions after HPV vaccine. Yes, there was a response from Dr. Offit. There is more from CDC. If you go to cdc.gov/HPV, which is the HPV portal, on the left-hand side, on the section that says for parents and the public, there's one on HPV vaccine safety. And within that article is HPV vaccine Q&As. And if you click on that, it's got a whole list, and it actually goes through several very specific conditions. Guillain-Barré syndrome, POTS, which is postural orthostatic tachycardia syndrome. So there's some things like that in there. So that's another really good place. It's not a direct response, but it is information about those. All right, I'm going to go to the next polling question. How likely are you to use the information presented during this webinar? And your options are very likely, somewhat likely, neutral or no opinion, or unlikely. While you all are responding to that, I am going to respond to the next question, which is, when will ACIP make HPV vaccine a requirement instead of a recommendation? So just very quickly, I'm assuming that means school requirement, and the ACIP is actually not the group that does that. So school requirements, which means basically that someone needs to be vaccinated before they enter a certain grade, is done by state legislature, or in the case of Rhode Island, sometimes by a health department requirement. And so that is not something that is in the purview of CDC or the ACIP. ACIP just makes recommendations, and then, clinicians carry out those recommendations. It's up to the states on whether or not they have mandates. An HPV vaccination mandate is actually not thought to really improve HPV vaccination. We have had some states that have had it, and it hasn't worked very well for them. But what we do know is that states that have both a Tdap and a meningococcal recommendation have higher vaccination rates in those states that don't have that as a requirement for 6th or 7th grade entry. And really what it comes down to is the thing that makes the biggest difference is an effective recommendation from a provider that parents trust, that bundles all 3 vaccines at the same time and really normalizes HPV vaccine. All right, so I'm gonna, let's see. I'm going to take the next one too, which is about reading level. So yes, I mentioned that some of our fact sheets are for higher information seeking parents, but all of our fact sheets are actually written at a federal plain language standards level, which takes into account more than just like grade level for reading, but really we work on a lot to make sure that these are effective plain language wise. And so even our fact sheets that are for the higher information seeking parents are written in plain language, as are our materials for clinicians are actually written in plain language as well. Now, if you have someone who has a very low literacy, we have things like videos. I recently watched a series of videos about HPV that were actually in motion comic or motion graphic style, so it looks like a comic book that's slightly animated. And we're hoping to get some of those materials up on our partner portal, which will hopefully be up in the next few weeks. And there'll be links to those. And so those are the kinds of things that work really well with truly low literacy folks that aren't going to be able to read a general fact sheet. And I'm going to have you take the next question.
Sure.
This is probably going to be our last question, but we can email folks with answers to the other questions.
Sounds good. So what suggestions do you have for strategies for providers to measure vaccination coverage rate in states where the IIS system do not have the ability? I think for provider staff to not have the ability to measure their coverage with the click of a button using the IIS would be very difficult and burdensome for staff to spend the time working on that. What you can do, what they can do, a process that they can follow is to pull charts in their clinic and enter their data manually into COCASA and run the coverage that way. But again, without the IIS, I don't think it's feasible to really expect provider staff to spend time running their own assessment coverage reports.
All right, well,
back to you, Jill.
Probably, do you want to try and answer one more real quickly?
Yes. So the next one is the link to HPV. We can send that. Can you please reiterate where the email? When did you say that? Okay. So the training, Gracie, the training manual should be coming out. It's going through clearance right now. It's been going through clearance for a few weeks, but we're expected to see it by the end of this month. So we will send it out to programs to review it, but it should definitely be ready before end of this year so it can be used for training purposes. Will states ever be required to use the, I'm sorry, just one last one, Jill, I promise.
Sure, one last one, yep.
Okay. Will states ever be required to use the online AFIX tool? We do several AFIX per year, and it is a lot of paperwork. I agree with you. The AFIX online tool is being used by most awardees right now, with the exception of around 5 programs. There's a lot of discussion internally about requiring it, and I'm sure we will let you know more information once a decision is made. That's
all right.
That's
well,
my response to that last one.
Yep. I want to thank everybody for being on the webinar today. If you have questions about where the materials are, I encourage you to go to cdc.gov/HPV. You can also respond to the emails that you received about registering, about getting the slides, or you can send an email to Preteen vaccines, plural, @cdc.gov. Thank you so much, and everyone have a great day.